Okay, thank you for having me. I have no disclosures. And I just want to thank my colleagues, Drs. Martinez and Tolomat, who assisted with preparation of this talk in prior years. This is case one. It's an audience response question. So, 67-year-old man presents with a 4-year history of a slowly growing papule on the right upper lip. The lesion is most likely A, basal cell carcinoma, B, squamous cell carcinoma, C, Merkel cell carcinoma, D, amelanotic melanoma, or E, B-cell lymphoma. Okay, excellent. Basal cell carcinoma. The next best course of action is A, biopsy the lesion, B, treat with topical steroid, C, treat with cryotherapy, or D, treat with electrodesiccation and curettage. Okay, perfect, biopsy. You wouldn't necessarily want to start with treatment. You want to biopsy to determine if it is indeed a basal cell carcinoma. It's imperative to get tissue for diagnosis. Although it most likely is a nodular basal cell carcinoma, there are rare tumors that can mimic clinically a basal cell carcinoma, including amelanotic melanoma. We typically think of melanoma as a classic brown, black papule or nodule on the skin, but it can, in rare cases, be red or pink. And a lot of dermatologists have biopsied lesions that we think are basal cell, and we're shocked when we get a report that shows amelanotic melanoma. So that's why it's crucial to do a biopsy rather than jumping to treatment. Other rare tumors that can mimic clinically a basal cell carcinoma include Merkel cell carcinoma or an adnexal neoplasm. These are tumors that arise from the sweat gland or the hair follicle in the skin. So you need a diagnosis not only to bill a treatment, but determine how you treat it. You treat a melanoma differently than you would a basal cell carcinoma or a Merkel cell carcinoma. So our objectives today, we'll review some statistics of skin cancer, as well as the most common types of skin cancers, how to choose a biopsy, and then how to increase your sensitivity of biopsies. So non-melanoma skin cancers are most of what we see, and basal cell carcinoma is the most common skin cancer. These are from 2016 statistics, but there have been over 4 million new